Good evening, this is Viewpoint. I'm Zakka Jacob. Last night, in his address to the nation, the Prime Minister very emphatically said that lockdowns should be the last resort. He in fact also said that he would urge state governments that have already locked down in some form or the other, either weekend curfew or night curfew and so on and so forth. He said he would strongly urge those state governments to reconsider their decision because medically speaking, there is no evidence to suggest that these lockdowns actually help slow down the spread of corona. What they do, though, is buy some buffer time for those state administrations to build up their health infrastructure to deal with this massive influx of corona cases. The question is, why are state government after state government imposing lockdowns when not just the Prime Minister has discouraged that, but more importantly, there is no medical evidence to suggest that lockdowns help. But first, the story.
मैं राज्यों से भी अनुरोध करूंगा कि वो लॉकडाउन को अंतिम विकल्प के रूप में ही इस्तेमाल करें।
सभी परिस्थितियों का जायजा लेने के बाद आपकी सरकार को ये लगता है की दिल्ली में कुछ दिन के लिए लॉकडाऊन लगाना जरुरी आहे।
रोजीरोटी महत्त्वाची आहेच, त्याहीबद्दल मी बोलणार आहे, पण रोजीरोटीच्या बरोबरीने आधी जीव वाचवायला पाहिजे। जीव वाचलं तर सगळं काही आहे आणि जीव वाचवणं हाच आता समोरचा महत्त्वाचा मुद्दा आहे आणि तो वाचवण्यासाठी मी पुन्हा एकदा सगळ्यांना हात जोडून विनंती करतो आहे की आजपर्यंत जी काही निर्बंध आपण टाकलेले होते त्या निर्बंधात आता आपण अधिक वाढ करतो आहोत।
All right, let's just run you through the states that are in some form of lockdown or the other. Either it's a weekend curfew or a night curfew. Let's run you through the biggest states that are witnessing this right now. Maharashtra right now is under a Janta curfew till the end of this month, but likely tonight, later tonight at 8 p.m., we're expecting Uddhav Thackeray, the Chief Minister, to address citizens in Maharashtra and announce a complete lockdown till the end of this month. Also in Delhi, the national capital, complete lockdown till the 26th of April. It started off as a weekend curfew the previous weekend, and now earlier this week, Arvind Kejriwal extending it all the way to next Monday. Likely it could get extended as well. Uttar Pradesh yesterday deciding that there will be a weekend curfew across the state, as well as night curfew in some of the major cities in the biggest state in the country. Karnataka, again, just yesterday, right after the Prime Minister's speech, announced a weekend lockdown as well as a night curfew. Jharkhand, there's a complete lockdown till the 29th of April. And mind you, this is at a time when many migrants, and a large number of them happen to be from Bihar and Jharkhand, are returning home. But Jharkhand has gone into total lockdown till the 29th of April. Rajasthan has a weekend curfew till the 3rd of May. And then Chhattisgarh, which is also seeing a phenomenal number of cases this time around, there's a total lockdown in all districts. The question is, state after state is implementing some form of curfew or lockdown or night lockdown, call it what you want. Why are they doing that, despite the fact that the Prime Minister emphatically last night saying that there is no need for a lockdown, it should be a measure of last resort, and more importantly, there isn't any medical evidence to suggest that lockdowns actually help. Neha Joshi, BJP spokesperson, joining us. Anshul Avijit, Congress spokesperson. Dr. Tripti Gilada is infectious diseases specialist at the Masina Hospital in Mumbai. And Dr. Rajesh Chawla, senior consultant with the Institute of Critical Care and Respiratory and Sleep Medicine at Apollo. I'll start with the doctors first because let's get the medical side very clear on this. Dr. Gilada, is there any evidence to suggest that a lockdown, in whatever form it's being imposed, night curfew, weekend curfew, or even total lockdown, which some states are seeing, a lockdown actually helps slow down the spread of COVID-19?
So, like you rightly said, that lockdown is like the absolute desperate last resort that any state would want to do. The thing that we know definitely works is micro containments, and that has been tried by Bombay and by a lot of cities and a lot of districts in Maharashtra. And despite all those micro containments and Janta curfew, we've still continued to see a rise in the cases to the extent where the healthcare is being burdened. So I think there definitely is no scientific evidence for a lockdown, but given the present scenario with overburdened healthcare system, we just need anything that can slow down the numbers.
So, Dr. Chawla, while yes, Dr. Gilada is right, and many doctors agree that the healthcare system is overburdened, whether it's in Delhi or Mumbai or any of the major cities, but how does imposing a lockdown ease the pressure on an overburdened health system? Dr. Chawla, you have to unmute yourself, sir. I can't hear you. All right, we'll come back to Dr. Chawla. I don't think he's speaking to us now. Let me go. All right, Dr. Chawla, if you can hear me, please answer that question. How does imposing a lockdown in whatever form it is, night curfew, weekend curfew, etc., how does that ease the pressure on an overburdened health system? We know that the health system is sort of literally bursting at the seams, but how does imposing a lockdown help that? Dr. Rajesh Chawla, can you hear me? All right, I don't even think he can hear me. I'd ask our PCR folks to through his line first, and then I can go back to him. But let me go to Anshul Avijit and to Neha Joshi. Neha Joshi, the Prime Minister making it clear last night, lockdown should be a last resort. But then the opposition is turning around and saying that, you know, in 2020 when Corona first struck, this was our first resort. And it was the central government that imposed a lockdown.
Thank you, Zakka. Thank you for having me. And the doctor said this, and even you mentioned this in your introduction. There's no medical evidence that lockdown is going to really sort of curb the spread of the virus. When we started out in 2020, the scenario was very different. We did not understand this virus. The medical community, the scientific community, they needed time to understand the virus. Infrastructure needed to be put in place. You remember around this time last year, what we used to hear on news channel was there were no PPE kits for doctors. I still remember this incident where in West Bengal, doctors were made to wear plastic bags and raincoats, and such news was coming from all over the country. There were no masks, sanitizers were in short supply. So today we don't hear any of that because, you know, that part we had anticipated and the production was increased, the infrastructure was put in place.
No, but today we are hearing about shortage of oxygen. So
Absolutely.
what do you do about that?
I was coming to that, Zakka. So, I've been listening to all the experts on TV, just like everybody else. You know, I'm COVID positive right now, can't step out of the home. So all I have access to is, all the news channels. So I've been hearing experts speak, and everybody is of the opinion that in December and January, we really put our guard down. With the cases reducing, the production of some of these drugs that we see in short supply right now, that went down. The companies actually stopped producing those drugs in large numbers. The state governments also, most of the state governments failed to anticipate that this was going to be this way. If you look at Europe in contrast, Zakka, even today, most of Europe is in some degree of a lockdown. Some of the countries are in complete lockdown. Others have like a sort of a controlled lockdown, much like what we had in the different phases of unlock in our country.
Okay.
So I think, going through those
you are
gradations of a
saying
lockdown
that back in December
works
and
better.
January, when the cases were low, we let our guard down, which I think is correct, and that's the reason why we are faced with this situation. But B, you're saying that the states failed to anticipate that there would be a second wave, and therefore they should have been prepared for oxygen or remdesivir, the shortages that we're currently seeing. So Anshul Avijit, respond to that, please.
We who let the guard down means the government let its guard down. They are the ones who didn't place the orders. I mean, the Home Minister admitted as much when he's been coming on TV for the last couple of days, where he said, like, we allowed the Kumbh to take place because there were very few cases. So going by that logic, what you have in December, January and February are few cases, and therefore you did nothing at all to prepare yourself. The question has been answered by you.
Why don't you say, Anshul, that when you say we
I
let our
just
guard down?
respond?
One second,
Let me
Neha.
just
I'm still asking him a question. When Neha says, we let our guard down, she means we as the people let our guard down. And you know this. You go around town, you will see people who are not wearing a mask properly, who are not maintaining social distancing, and that's a fact, isn't it? For the last 3 months, we had let our guard down. Anshul Avijit.
Certainly, Zakka. First of all, let me wish Neha ji a very, very speedy recovery. I'm sad to hear about this, but let me tell you, there is a social contract that the people have with the state. The state is responsible for looking after the people, and this looking after the people is mediated by something called democracy and elections. They're in charge of it. They have the resources. They have the wisdom. I mean, you have forfeited that wisdom to the state to look after you. Of course, the people left their guard down. They stopped wearing masks. Of course there was irresponsible behavior. Keep blaming the people. And that does not mean that the state abdicates its responsibility and does not prepare for the future.
Okay.
As for the lockdown, Zakka, let me tell you about the lockdown. I do agree that as far as opportunity cost is concerned, there's a huge price to pay for a lockdown. I do agree with that. But the states have been pushed to a corner. What choice do they have with the incompetence of the central government to prepare for them? They have left with no choice
No, but
except at this time. Yes.
Anshul, like, they need hand-holding from the center, and they need, on the one hand, you're saying that they need hand-holding. On the other hand, they're rushing to the center for everything from vaccines to oxygen to God knows what. So you can't have it both ways, right? Anyway, I'll give Neha 30 seconds to respond, and I want to go back to Dr. Chawla after that. Neha, respond, please.
Zaka, just a limited point here. Every time you come on these debates, you want to not make it political, but the Congress spokespersons almost force us, He's talking about the Kumbh, the Maha Kisan rallies that Priyanka ji was addressing. What were they about? This is not the time to indulge in a blame game. The Mahavikas Aghadi government permitted film shootings to take place. Every person who was on those film sets has tested positive. Why were we allowing this? If we go into which government was doing what, the point is that how are some states doing better than the others? What did these governments do? What are the best practices that we can probably replicate across the states? Let's have a sane conversation, a constructive conversation. I don't understand what is this compulsion to indulge in petty politics always.
Okay, let me go back to Dr. Chawla. Dr. Chawla, the question I was asking you is this. While yes, there is no medical evidence to suggest that lockdowns help other than to use that buffer time to build up your health infrastructure, right now what we're seeing is state after state imposing some form of lockdown, whether it is night curfew or weekend curfew or whatever it is. But at the same time, the pressing need, whether it is for oxygen or remdesivir, is right now. By putting in a 2-week lockdown, how does that help ramp up required oxygen or required drugs right now? The need is right now, not 2 weeks from now.
See, the problem with this new strain is it is very infectious. Last time, the infectiousness was not that much. The infrastructure which was created during lockdown was able to cope up with the need.
Okay.
Now, they thought it would be somewhat similar, but the need for this second surge was much more than they anticipated. I think it was there in Mumbai when they were seeing that in Mumbai they have pressed against, and there was a time of a month. Probably that could have been utilized to prepare Delhi for this kind of. Now, every 10 minutes, 15 minutes, I get a call for a bed, just a bed or an ICU bed. And most of the places people have gone, they're not finding a bed. This is a situation.
No, but
So you
doctor,
were asking about,
if it is also true, sorry I'm interrupting, but if it is also true that more than 85, almost 90% of cases in this second wave are asymptomatic or mildly symptomatic, do not require hospitalization, then why is there so much pressure on beds?
because the number of patients is so huge. See, even if 10% of people require, their number becomes too much, because what you are seeing every day that there are more than 28,000 patients or whatever, but actually more than that, who are not being tested. So there is a good amount of number of patients who are there, and amount of patients who are requiring oxygen is also large. Somehow I have noticed that the patients who get sicker or who need oxygen this time is more, particularly in Delhi. We had not seen this kind of thing in the first surge which was there.
So
there is a difference.
you're essentially saying the difference is this time a lot more patients are requiring oxygen. I'm assuming that's because of respiratory concerns. We were not seeing this in the first wave. In the first wave was more, a dry cough, which seemed to be the quintessential sort of symptom amongst most people.
There are symptoms also different. More people are having loose motions, loss of smell and taste. These are more predominant symptoms this time.
Around.
Every other person has.
Okay. I want to go back to the political spokesperson, and I want to start with Neha Joshi. We're just going to be breaking the story in just a few minutes as well after this debate. Most hospitals in Delhi are now reporting a shortage of oxygen. You heard Dr. Chawla talk about this as well. Why is it that we could not anticipate this need for oxygen? We've seen the second wave in countries abroad. We've seen the second wave in Maharashtra. Maharashtra has been having the second wave since February, March. Why could we not anticipate the production of oxygen? In a state like Delhi, for example, it does not have any oxygen plant of its own. It has to come either from Punjab, Haryana, or it has to come from Uttar Pradesh?
Well, Zakka, don't you think that's a question that you should ask a representative from the Delhi government? But I, because I represent BJP, which is in the government at the center, I will ask that question, answer that question to the best of my abilities. What we see in the way the Delhi government has functioned in the past 1 year, most of their focus has been on advertisement. Now because I'm at home and I'm watching TV so much, every 10 minutes I see Mr. Kejriwal face on a TV channel. He's appealing to people, he's making all of these appeals, but I wish all that budget was spent on actual work on the ground. We are running a campaign called BJYM Cares. The youth wing of the BJP is doing something called BJYM Cares, where we're trying to really link people to resources, help out however best we can. Most of the calls, we launched a helpline yesterday. Out of the 1,500 calls that we've received so far, 50% are from Delhi. Delhi is sinking. The government failed to
Ma'am,
first
but can you
control
explain
the
to
surge
me,
of the
no,
virus.
can you explain to me how industrial oxygen can be ordered to be shifted to medical oxygen by a state government? That's not the remit of a state government, any state government for that matter. Especially when,
Zak,
especially when
I'm
those
not saying
industrial
that.
oxygen units are
However,
not in that state. That's my
however,
limited point.
you don't wait till doomsday to make those demands. You
Okay,
don't come
that's
on
fair.
television, call a
Yeah,
press conference and
that's
make
fair.
those demands, Zaka.
No, that is fair. That is fair. Yeah.
Administration, if you're a good administrator, you anticipate these demands. You sit with experts. There are all kinds of experts in Delhi. I mean, Delhi is where all the knowledge is. Why
Okay.
couldn't you sit with a Dr. Guleria or any of these heads of hospitals and figure out how much oxygen are we going to need in the next 6 months, for instance?
Okay, let me go back to Anshul Avijit. So blaming the centre there doesn't cut ice, because state governments should have prepared. And the doctors are right on the panel. We had the evidence of Maharashtra before us. Maharashtra was going through this back in February. Delhi and other states are only facing it now in April. Surely we could have sensed that the symptoms this time are different, the requirements this time are different. None of the state governments did that.
Zakka, it's very, very sad that the battle to fight COVID has turned into a battle between center and the states, and between states themselves. They've all been compared from one to another, and we are being accused of petty political point scoring when it's the health minister who shoots off all kinds of nasty and absurd letters, and it's Mr. Piyush Goyal who says that the states should manage their demand for oxygen. I mean, the nerve to say such a thing. Let me tell you, Zakka, that it was our, Mr. Amrinder Singh wrote to the center last year saying that please give us permission to have oxygen plants in Patiala and elsewhere, and he was denied. He's still waiting for that permission. So it's not that people did not anticipate that demand for oxygen in various states. It's just that after the deployment of these acts of the Disaster Management Act, the Epidemics Act, and what have you, a lot of the powers of the have been concentrated with the center, who gives no maneuverability for the states to act.
If the centre has all the powers, Anshul, how come states are going around like busybodies imposing lockdowns everywhere? Under the NDMA, they don't have those powers either.
Well, they have to do something. When they're pushed to a corner, they have to do something. Now you've had a dual pricing policy, which is going to create immense havoc.
Okay, that's a different debate. That's a different debate.
We'll
get to that. We'll get to that as and when we get to that. But that's a different debate. I'll give the final word to Dr. Gilada. What is the most immediate and pressing concern, Dr. Gilada? Because I've seen many of your videos talking about how you can take care of COVID patients at home and so on and so forth. If folks are watching this and they have people who are COVID positive at home and are looking for a bed and so on and so forth, what is it that they can do at home itself without further burdening an overburdened health system?
So I think the most important thing for people to still understand is that majority of the people will be able to be managed at home. So just being tested COVID positive shouldn't cause a state of panic, and that shouldn't push stable people to occupy hospital beds that we really want to be left vacant for people who require oxygen and require close monitoring. So the most important thing is don't panic, get in touch with your doctor. More than likely you will be managed at home. And if you do require the hospital, we hope that with further planning and further implementation of the strategies that are being planned, we will have more beds in Mumbai and all the other cities. And with the oxygen coming in, we really hope that we do not have to turn down our patients just for the lack of oxygen.
All right, we'll leave it at that. Thanks very much. I once again want to wish speedy recovery to Neha. She's again setting an example by staying at home despite being COVID positive and treating herself at home, of course, with the consultation of doctors and experts. Thank you very much to all our panelists. We're getting this piece of breaking news again in keeping with something that we talked about in the chat. Now, two big hospitals in Delhi, the Max Hospital as well as the Indraprastha Apollo Hospital, two big private hospitals in Delhi, have come out and said that they're facing a severe uncertainty, supply uncertainty and delays for oxygen, and that is leading to serious concerns regarding some kind of calamitous incident, God forbid, involving patients, because right now they say that supplies are uncertain, oxygen supplies are uncertain. It could run out in the next day or so. Just yesterday, the Sir Gangaram Hospital had also come out and said that they have just 5 hours of oxygen left. So Runjun Sharma is joining us on this breaking story. So now you have Gangaram Hospital, Max and Indraprastha Apollo, all of them coming out and saying they have limited supply of oxygen. Is there any word you're getting in from either state or centre on how they plan to bolster this?
Zakka, also St. Stephen's Hospital as well as Holy Family Hospital. All these hospitals saying that we have only hours of oxygen left and that they are in dire need of oxygen. Why? Because many of their patients are totally dependent on oxygen supply. So it is a dire need. And what's really happening on the ground seems like a complete breakdown of communication between the state and the center. We saw the chief minister, the deputy chief minister, the health minister of Delhi send SOS message to the state saying that they need oxygen to sustain the hospitals. But we've seen now blame game also put on state borders, saying that UP is not letting oxygen in, and even Haryana, for that matter, is not letting oxygen in. But unfortunately, situation on the ground remains extremely grim, Zakka, given the fact that Delhi has recorded a record number of cases. Even yesterday, over 28,000 cases and close to 300 deaths. There are more and more patients who are being rushed to the hospitals who are in need of oxygen. Let me just put things in perspective, Zakka. Any hospital at any given point in time needs at least 36 hours of medical oxygen backup. That's definitely not there. For example, Sir Gangaram Hospital, they say that every single day they need at least 11,000 metric tons of medical oxygen. What they have is only half of it, even less than that. So what they're really dependent on is sending, requests to the Delhi government. A lot of refill, which is happening right now, Zakka, is also happening by private oxygen tankers.
All right, I'm afraid we have to completely wrap it up. Thanks very much, though, for joining us, Runjun, with this breaking development. Meanwhile, as we quickly wrap up, this is another big story. 2 days after the centre decided to open up vaccination to all above the age of 18 starting 1st of May, the Serum Institute of India, which manufactures Covishield, has said that it will now be available to all state governments to directly procure at 400 rupees a dose and private hospitals at 600 rupees a dose. The company says 50% of its capacities will serve government's vaccination program and the remaining 50% capacity will be for state governments and private hospitals. Shireen Bhan of CNBC TV 18 spoke with Adar Poonawalla, the CEO of Serum Institute.
The price for procurement by state governments is going to be 400 rupees per dose, and for the private market, it is at 600 rupees per dose. Whereas for the central government, it is 150 rupees per dose. Adar Poonawalla, why the difference when we talk about the centre and the state governments?
So let me clarify, Shireen, it is not a different price. All government prices will be 400 rupees henceforth for new contracts. Now, please understand, the 150 rupee price which is being thrown around has been for the central government for prior commitments and contracts. After that ceases to exist, after we supply about 100 million doses to them, which was ordered in bulk a long time ago, we will also charge 400 rupees to any government. Let me clarify that. So that is why there should be no confusion that after the opening up of this change in policy, the new price to government is 400 rupees. And after that, for private hospitals, it's 600 rupees. Also, to put this in context, it is roughly half the price or 1/3 the price of most global vaccines everywhere in the world. And also, if you compare this to our own prices in export markets, those prices were given again
a long time ago in 2020 when we had made contracts without even knowing if the vaccine would work. So those prices were at $4 and $5 going down to $3 because that time when we got money from different countries, including COVAX, we didn't even know if the vaccine would work. And this was like a risk sharing price that we had agreed upon for a certain limited amount of quantities.